So good afternoon, good morning, good evening, everybody. Welcome to this webinar on advances in oncology nursing practices. This has been brought to you by the Mahatma Gandhi Medical College Hospital, the Shri Ram Cancer Center, the Journal of Carcinogenesis, and the Carcinogenesis Foundation. And we'd like to welcome all of you and join in celebrating the Oncology Nursing Month. You know, when you look at patient care and you look at a chariot in which we are carrying the patient to good health, the two main wheels, one is the medical professionals, the doctors, and the other is the nurses and the nursing. And if I may be permitted to say so, I think the nursing wheel is as important, if not more important, than the other wheel. And for every single patient and the patient's family, the experience when they are in the hospital or when they are discharged from the hospital is directly proportionate to the quality of nursing they get. You may have a good doctor, but if you have a not so good nurse, then the aggregate experience of the patient or the patient's family is negative. And conversely, if you have a not so good doctor, but if you have a good nurse, then the impression and the experience of the patient on discharge is by and large positive. So all of you, all of our nursing colleagues are incarnates of Sarojini Naidu and Florence Nightingale. And in this Oncology Nursing Month, all of us medical professionals salute all of you and the fantastic work which you are doing. And to just commemorate that, we have this Advances in Oncology Nurses Practice webinar today. This will cover several aspects of oncology nursing, and which I hope will be of benefit to nurses in India and abroad. Uh, Quite a large part of our faculty is from the United States, and it is 3 o'clock or 4 o'clock in the morning for them. So you will please permit us, we have taken the liberty of recording some presentations, but I assure you that everybody who is presenting will join as soon as they wake up this webinar, and they'll be available and ready to answer your questions. So if you have any questions, please post them on the chat box, and in our panel discussion at the end of all the talks, our moderator will make sure that all those questions are answered. And I will also request our nursing faculty to answer as many questions as possible on the chat box as they can. So I'd like to acknowledge the help of Professor Gopala in organizing this program, and my very dear friend Dr. Lalit Mohan Sharma, who is instrumental in these nursing activities which we do. This is really a passion with him, and once I finish my introductory talk, I will request him to take over. So we have several topics to be covered today, and you can see some of the topics over here. The nurse's role in surgical oncology, the nurse's role when the patient is receiving radiation treatment, how to prevent and treat extravasation, fluids and electrolytes and diet counseling during chemotherapy and radiotherapy, care of the central venous access devices, management of the pediatric cancer patients, prevention and treatment of the patient with neutropenia. If the patient is receiving immunotherapy, the new form of treatment, what should be the nurse's role and responsibility, the very important role of palliative and end-of-life care nurses. And then we'll have a comprehensive panel discussion of a good half hour, 40 minutes, which will cover all the practical aspects and also discuss your questions. So with this brief introduction and with this brief platform, I'd like to hand over proceedings of the webinar to my very dear friend and colleague, Dr. Lalit Mohan Sharma, who is also the co-director of this program. He will invite the chairpersons for the first session, and they will then invite the first speaker. So I hand over proceedings to you, Dr. Lalit, and thank you once again, everybody, for joining us.
Sir, thank you so much. And before we move to the academic session, may I request you to say a few things about dedication of this webinar in the memory of Dr. GS. So may I request you to say a few words about Dr. Gauri Shankar Bhattacharya before we start the proceedings.
Yeah, thank you very much. We lost Dr. Gauri Shankar Bhattacharya to COVID on the 1st of May. And Dr. Bhattacharya was my best friend, my soulmate, my sounding board, brilliant medical oncologist of this country, an out of box thinker. And I think he was one of the single most important persons to take oncology awareness, Indian oncology, to Europe and the USA. And we'd like to dedicate this nursing webinar to the memory of Dr. Gauri Shankar Bhattacharya, the role of nurses, the importance of nurses, and the importance of nurses teaching and training was very, very close to his heart. And we are very happy to dedicate this webinar to the memory of Dr. Gauri Shankar Bhattacharya. Thank you, Lalit, for reminding me. Please.
Thank you so much, sir. Thank you.